Morning, all.
Morning, Rain.
Oh,
Oh,
look
and
at
good morning, Kate and Kim from
yeah.
Denver, Colorado.
Woohoo!
Kate, it's Kate, Kim, Marissa, Latoya, and Aditi are all representing Massachusetts in Denver at the prenatal to three. I don't know the name of it. I'm gonna mess it up. What is
the,
it?
the Prenatal to Three Policy Impact Center
Woo!
campaign. And Sunday Taylor is with us as well.
And Sunday Taylor. That's right. That's great. Wonderful.
So we're
Well,
doing what is a 7:30 call
that's
watch
right.
party here.
Welcome to the 7:30 call in Denver. Yes, we have a great team. Um, Speaking of great teams, we're so happy, thanks for that setup, to have Annie and Rachel with us today. And Annie, apologies, I put Rachel's name as the presenter, so she corrected that yesterday. And so we're pleased to have both of you here today. And our first question on the 9:30 call is for each of you to tell us a little bit about you and how you came to be in your current role. And we do want to know whether you're a Yankee or a Met fan, to get things started. So, I'll just turn it over to you.
All right, I'll jump in and then I'll turn it over to Annie because it's really her show. But go
Great.
Mets, first
Okay,
off.
well, you're welcome. You're welcome, is all I have to say about that.
Thank you. Thanks, Uncle Steve. Um, my name is Rachel. I am the Director of Communications at the New York Early Childhood Professional Development Institute. And how I came to be in this role, I started my career as a teacher, as an elementary school teacher in New York City public schools. And from there, when I was teaching, I had a blog. It was back in the day when like everyone had their own teaching blog. So I had this anonymous teaching blog that the United Federation of Teachers, the Public School Teachers Union, used to publish my entries in their new teacher diaries. So after I had been teaching for about 5 years, I transitioned. There was an opportunity that opened up at the U of T, so I transitioned to working for them in communications. So kind of combining education and communications. I was there for 10 years, and then I came over to CUNY PDI.
That's such a cool story about the blog. I love it. Thank you so much, Rachel. And Annie, what about you?
Hi, everyone. I'm Annie Schaeffing. I am Senior Policy Advisor for New York Works for Children. And like Rachel, I started my career as a teacher too. I was a Head Start teacher for several years, and then I transitioned into more kind of the administration side of things. I worked for a few years at DC Public Schools doing special education school placement for children under 5, and then moved to the Office of the State Superintendent of Education in DC in their Division of Early Learning. Worked on early childhood workforce development issues there, including some of their initial compensation work, which was really exciting. And then my husband got a job in New York. And so now we are in New York. I'm very happy to be with CUNY PDI. And you know what? I'm still kind of a Nats fan. I know I need to choose. I've been like taught all my life to hate the Yankees. So if I had to pick one, it would have to be the Mets. I don't know.
All right, Annie, you're welcome here. Can you, and so I'm sure you'll tell us about the, so about the report and kind of the organizations involved in it. That would be great.
Yes, yeah, happy
Great.
to.
Okay, well, if you want to share if you have slides, you can share your screen. That'd be great. And thank you so much for telling us what that's always our favorite question here to have answered on the 9:30 call.
All right, here we go. We will get into it. So as Rachel mentioned, we're part of CUNY Early Childhood Professional Development Institute. Rachel, I'm going to give a little summary, but feel free to jump in if I miss anything. CUNY PDI does a host of things for the early childhood workforce in New York, but we're focused on professional development. We host the Aspire Registry, which is New York's early childhood workforce registry. We run New York's QRIS, Quality Stars New York. And so we have a close relationship with the state OCFS. We also, so this work was born out of PDG. So this was funded by PDG Birth to 5. We were requested to do this study kind of based on the data that's in the Aspire registry. And then we also completed a survey to kind of fill out some of the edges as well. And then based on that data, created some recommendations for moving towards parity compensation in New York State. Rachel, do you have anything to add on PDI or basics about the organization we should share?
Yeah, we also have a career development center that kind of went from New York City to statewide. So we do a lot of work around the workforce and compensation, benefits, credentials, education, like how are the ways that we can strengthen the workforce in New York State?
Thank you, Rachel. Okay, so we will dive on in. So today I'll be presenting highlights from this report that we wrote. It begins with kind of a background of what is the reality of New York State currently, and then goes into our recommendations. And so I'll kind of try to fly through this a little bit so we get some time for questions at the end. So first we wanted to start by defining what we mean when we say parity compensation. So for our purposes of this report, we are saying that parity compensation is that early educators, so those who work with infants, toddlers, preschoolers, whether in family child cares or in centers, should be paid similarly to teachers who work in elementary, middle, and high schools. I'm preaching to the choir, but we know their work is just as skilled, just as important, and often they do have similar credentials to those folks. But despite this, the poverty rate for early educators in New York is 19.3%, which is more than twice as high as for New York workers in general, which is 8.6%. And we also know this is an equity issue. 94% of early educators in New York are women, and 57% identify as a race other than white. And then in my talking points for the state, I had all these great things to say about how important early education is. I'll skip over that because I know you all know that. So we'll move along. We'll begin by painting a picture of what currently exists in New York. So this first set of information is what comes from that Aspire registry, New York's workforce registry. But Aspire membership is not mandatory. So this represents a sample of the workforce in New York. We do believe it's representative based on other research that's been done, but just to say this is not everyone. This first slide is the median or average compensation for early educators in the state. And you'll see that for our purposes, we broke this down by New York City and the rest of the state. That's for a few different reasons. There are different regulations for early educators in New York City that include higher credential requirements. And then obviously the cost of living in New York City is just different than other parts of the state. So we thought it was important to break it out. So you can see that mostly folks in New York City make more than folks in the rest of the state, with the exception of family childcare providers who actually make less than people in the rest of the state. But as you can see here, these are low salaries across the board, whether you're in New York City or live elsewhere in the state. Then we also broke compensation down by a few other measures. So this is compensation by highest level of education. Unfortunately, we didn't have enough data in the registry to do a good analysis on family childcare providers, so that's why they're not represented in this chart. But you'll see that there is a modest increase in salary with the attainment of a bachelor's or a master's degree. But for folks that have either CDAs, some college, or an associate degree, who are all represented in that associate degree column, you can see that they actually earn slightly less than their counterparts that don't have any higher education. So obviously right now there's not a lot of incentive to go to school to get a degree because you're likely not going to be paid more. The next table looks at median compensation by years of experience at current jobs. So we know in lots of fields, the longer you stay in the field, the more you get paid. There's an incentive to stay at your employer because the longer you're there, the salary will progress. But this chart shows that there's a flat salary growth over time in our field. And the highest paid members of the workforce are those who have been in their jobs for the shortest amount of time. So that obviously gives us a clue about turnover as well. If folks can leave their current center and get paid a bit more somewhere else, they're going to do that. There's not a reward for staying with your current employer. And we know this is particularly problematic in early childhood education because infants and toddlers learn in the context of a relationship. So if your teachers are leaving, that can be challenging for the learning and development of children in their care. So we wanted to highlight that. Again, this is kind of our section of the report that's building the case. Like this is what exists currently.
Annie, there was a question in chat. Why does someone who has an associate degree make less than one with a high school diploma? Do you have any insight to that?
It's a great question. If I had to speculate, I wonder if it's connected to this years of experience at current job situation.
Right.
But that's speculation. I do not know.
Okay.
But it is a relevant finding, obviously, and points to the fact that it's not very encouraging for folks to go out and get a CDA or associate degree.
And then can you give us a sense of the sample size? You said it was like from the registry, which is voluntary, but you know the numbers of people.
Yeah, so it's from the registry, which is voluntary, and putting your compensation information in the registry is also voluntary.
Okay.
Off the top of my head, I don't remember the sample size. I'm sure it's referenced in the report.
Okay.
So if you want to look it up quickly. But I don't know it off the top of my head. I'm sorry.
And then could the compensation for years of experience be more for fewer years because the field is simply paying more overall in recent years?
Possibly. So that's like, so again, this is years of experience at current job. So this is someone who's been at a center for 10 to 15 years, and,
Right.
and someone coming in brand new is going to be offered more. That could definitely be it.
Right.
But again, that's problematic because that leads to more.
Right.
Yeah,
Thank you.
sure. Okay, so I believe that's all we have on the compensation side of things. The other piece that we wanted to expand on were benefits, because we know compensation is not just about pay, it's about the other benefits that promote stability, healthcare, all of those things that are important for professionals. So we don't have any information in the Aspire registry about benefits, and so we did a separate survey to get this information. We conducted the survey in May and June of 2023 in English and in Spanish. We had 1,024 respondents for our survey, mostly in center-based roles, as you can see, but we did have some family childcare participants as well. So we'll dig into those results now. We asked about health insurance, paid sick leave, paid annual leave, and retirement. So we found that health insurance is broadly available. Only 5% reported not having any health insurance. 25% reported getting some support from an employer towards the health insurance, but another 25% reported using Medicaid or Medicare. So a lot of our folks are using benefits. The next slide breaks it down in a little more detail. Again, you can see this in the report. For our purposes, I won't go into too much detail here. The orange bar are folks who reported receiving health insurance from their employer, either partially or fully paid for by them. The purple are those who receive health insurance through their spouse or their parents. Would highlight that here because folks can be on their parents' health insurance until 26. After that, they get kicked off. Do those folks stay in childcare, or do they leave to find somewhere that will provide them health insurance? The teal are folks that self-purchase health insurance on the marketplace. And then that light blue represents the Medicaid and Medicare folks. So you can see assistant teachers and family childcare providers are the most likely to access that. And that's kind of a theme you'll see throughout these results. And then these are voices from the field. So I did want to pull this out just as this is something you'll see throughout our report. We had an opportunity for folks to leave open-ended responses on our survey. And so this just adds a little color and tells us more about the challenges that these charts represent. So next we'll go into paid sick leave. 78% of respondents reported having paid sick leave. Obviously, we know that this is really important for early educators because kids get sick all the time. They pass those germs around, teachers get sick. And again, you'll see family childcare providers are least likely to receive paid sick leave. And we know this is likely due to the structure. They don't necessarily have subs that can come in and fill in for them on a day that they're not feeling well. And then we also asked folks, okay, you have access to it. Are you actually taking it? And so this looks at folks who actually took paid sick leave in the last 12 months. And we found an average of 30% of people did not take any paid sick leave. And then you'll see again, family childcare providers saying, yes, I have access perhaps, but I'm not taking it. And so again, that speaks to kind of the structural things that make it difficult for them to take sick leave. The next portion is annual leave. So again, we know annual leave is really important to reduce burnout. It's crucial for well-being, can lead to decrease depression, decreased risk of heart disease, all these things. So it's important that folks have access to paid leave. We found an average of 63% do receive paid leave. And again, assistant teachers were least likely to report paid annual leave from the center side, and then family childcare providers were also less likely to have access to annual leave. And then in terms of folks who took it, almost 25% didn't take any paid annual leave in the last 12 months. And again, the patterns just repeat. Assistant teachers, family childcare providers, least likely to take it. Okay, next we looked at retirement benefits. So of all the different benefits that we asked about, this was the area that illustrated the most need. Less than half of center-based respondents reported receiving any retirement contributions from their employers. And then in New York, some family childcare providers can receive retirement benefits from their union, but fewer than 10% reported utilizing those benefits. And that could be because our respondents, I don't know, we'll need to look into, I don't have an answer for why so few are accessing those. Some of our voices from the field may illustrate a bit of that in a moment. But even without employer contributions, 58% on average reported saving for retirement. And then again, family childcare providers, assistant teachers, less likely to report saving for retirement. And then we also broke this out by age of respondent, because obviously the older you are, the more we hope you have saved for retirement. But you can see that 26% of respondents over 55 said that they're not sure how much they have saved for retirement. And this is when we gave them big bands to pick from. You don't have to know exactly what's in your retirement account. You could say, maybe 40, you know, but folks weren't able to give us that answer. And then if you look at the purple and the teal slices on this chart, you'll see that many educators over 45 had less than $10,000 saved for retirement. And of course, we know that's problematic. The big point to make here is obviously retirement benefits grow over time. So if you're able to invest earlier in your career, you can see more retirement savings in the future. But a lot of folks aren't able to contribute anything. They're using all their paycheck to live. And we saw that reflected in our voices from the field. People are aware of retirement benefits. They know they should be saving, but they just can't do that. And then to kind of round out our picture of the field that we painted, we also asked folks about public benefits that they're receiving. And so again, a significant number of respondents reported receiving Medicaid or Medicare. So that's 25% total, 14% said they were receiving Medicaid, which again, just demonstrates the severity of the compensation crisis in early childhood. We also saw some things, given the eligibility limit for Medicaid, we think there may be some folks in the field who are missing out on other benefits that they could be accessing, such as SNAP, HEAP, these other things that could be helpful for them. But that's kind of the conclusion of our findings part of the report, where again, we're trying to build the case for like, this is kind of how dire things are right now. And if there are any more questions there, I can take them now, or I can move on to our recommendations piece.
I think and just a comment, thank you so much for this important work. We are having an incredibly difficult time finding teachers, even with parity in schedule and pay salary.
Oh, really? Oh no.
Right.
Information that I don't need to have. No, I mean, that's good to know. I would love to hear more about that. And I'm realizing we only have 10 minutes left. This is so brief. So I'll try to just get to the meat of it here, and I won't spend a lot of time on this. These are our main recommendations for parity compensation. Mirror the average pay of similarly credentialed K-12 teachers in the same county. So in New York State, we recommended going by county just because of how different things are place to place. Recognizing years of experience through a progressive pay scale, annualizing pay, because we know childcare teachers generally work 12 months versus 10 months a year. Salaries shouldn't be dependent on the age of children served. Infant and toddler teachers should make what pre-K teachers make, making sure to encompass benefits, and then also considering those special considerations for family childcare providers, given their business models and given that they work, compared to a teacher, they're a business owner, they're an administrator, they're doing a lot. They have more responsibilities. So before we get to the pay scale, we did say this should be aligned to a career ladder. We have an existing career ladder in New York State that's a bit out of date. It has been around a while. And so we recommend making some revisions to it, which are reflected here. The pre-level kind of is the beginner. And then as we go down, we go through CDA, associate degree, and increasing credentials from there. we do need to consider how folks who come into the field without a degree in early childhood are represented. So that's kind of a discussion we need to have as a state. And generally, there are probably a lot of details that would need to be added to this in conversation with the field. But we wanted to make sure we had like an anchor for our pay
Right.
scales. This is our example. And this is what our pay scale looks like without further ado. All right, so a lead teacher at pre-level is shown at the very bottom. You'll see in our report a full proposed pay scale that goes county by county. So folks in this, in our state that are curious what someone in Westchester would make can look to that. But essentially the way we got to these numbers where we looked at New York State Department of Education has a file each year that's average salaries for teachers county by county. And so we took the 5th percentile salary as a proxy for like a starting teacher salary and used that to get our kind of baseline, which is at career ladder level ECE 3A. So that's the grayish blue kind of in the middle there. That's someone with a bachelor's degree in early childhood with a birth to grade 2 certification. And so that's exactly equal to a 5th percentile salary for a pre-K to 12 teacher. And then from there below is a certain percentage of that. And then above, we did a 3% increase at each level. But the idea is that assistant teachers, center directors, family child care providers, and assistant family child care providers would have an adapted version of the pay scale based on their roles and responsibilities. And we haven't developed that yet, although it's kind of in progress with another group, but it's not in our report. And then the other thing I would say is that this is like the baseline, right? So if you've been in the field for 5 years, for 10 years, for 20 years, we expect some progression over time as well. Oh, I see so many things in the chat and I've not been looking, so I'll trust
It's
you.
okay. Yeah.
Okay, if you want to raise anything. And then you'll see in our report, we were asked to do a cost estimation. And so this is kind of like, these are other cost estimations that have been done for what a fully funded child care system would look like in New York State. This includes compensation and everything else. So these are big numbers. For our compensation piece, we estimated that it would be $3.3 billion total, $1.5 billion in new investment based on what we know people are currently making. This is, a rough estimate,
Right.
but for the purposes of illustrating to the state what it might cost. And then again, you'll see in the report implementation considerations, what else needs to be done, what do we need to think about, and I won't spend a lot of time on this because we may have questions. And then also systems considerations. So beyond just compensation, here are some other things that we should be looking at in the state as well. If we're asking people to get more degrees and credentials, we need to be building up those scholarship programs and making sure folks have access and so on. And then the other thing I'll say about the report is there's lots of examples of what different states have been doing too. So if you're curious, there's a big old citations list in the report you can look to too.
You can see our team from Denver is growing. So Aditi, Marissa, and Latoya have joined the Zoom room in Denver. There you are. Yes, it's a lot of joy out there in Denver. It's good to see.
So that concludes my presentation. I wanted to zoom through to see if we have questions or discussion.
I really appreciate how it's laid out. That career ladder is beautiful. It's so clear, and I think the implementation and the system considerations, it's very timely in Massachusetts as we are really thinking about credentials and career ladder. We had a lot of policy passed through the budget. That was kind of in a bill that they moved over to the budget, which is good news because it passed, but now we are really focused on implementation advocacy and what that looks like. So let me get to there's a conversation between Brian Dixon and Donna. And Donna also adds, after watching, yes, a marketing campaign on why this is such fulfilling work. After watching the wonderful Dick Van Dyke and Coldplay video, we returned to the Good Life Harvard longevity research and talked about the beautiful of living a life of passion and play. Would love to celebrate the gifts of this work. We have asked the question about, I think people are also, some of the considerations like about ages and salaries, right? We have kind of put ourselves in these corners. Edna says, thank you so much for highlighting the challenges in gathering limited information on FCCs. What steps do you think could be taken to ensure a broader pool of FCCs are included in research? Other research studies have also mentioned similar difficulties.
Mhm. I have a couple perspectives on that. One, just in my work that's like closer to the ground, I find family child care providers are kind of like, look, I'm here, I own my own business, I'm doing my own thing, like let me be. Sometimes they may not want to share
Right.
information. For us in the with the Aspire registry, long term, I don't know what Massachusetts registry looks like. I would love to see it to be mandatory for everyone to put their information in there, just because that's the
Right.
only way we're ever going to get a good source of early childhood data. So that would be my dream.
Yeah. We have a funding stream now that is going to over 90% of folks, including family child care. So we are getting some
Great.
data. I mean, it's not just about workforce, it's about in general, but I think we've heard from other states about mandatory, also then building in supports about how to help people get their information in the registry, make it user friendly.
Totally.
Susie says one of the barriers to pay equity is the difference in ratios required by early childhood. Tuition paid doesn't cover the pay for an infant teacher. For example, and the elementary school teachers ratio is 1 to 25. We can't raise our prices too high because we'll price families out of the market. It's a hard place.
Yes, that's
And then,
what we do say in our report is like this has to be publicly funded. It's parents can't pay more, and obviously
right,
providers don't have
we
money.
can't cut anymore, spread it out. Concern for the seasoned family child providers with 15, 20, 30 plus years of experience with no more than a high school diploma or CDA experience needs to be included in the recommendations.
Yes, that's something we've heard a lot too. We're really and something else that's come up with is competencies, like how do we measure competencies, and is there a way to
Yeah.
get that into a pay scale? And yeah, big.
I mean, also, like, we also know that, as Jerry Robinson says, we are the most overstudied and under-resourced part of the education system, like always having to prove things. So, Maribel says, as a family child care provider, it's worrisome to see the numbers and it reflects how much work needs to be done. I guess, Annie, that would be interesting for you. So, when did the report come out? What has your plans been for like getting this information out in New York?
Yeah, so our report came out in October. We had a ton of people on the webinar. And I was like ready to field all these policy questions from people like, why is it like that and not like this? I was like very ready to have those discussions. And instead it was folks like, okay, great. How do we make this happen? How do we advocate for this? How do we do this? And so we have been partnering with a kind of a few different organizations around the state to and including some folks that do like legislative advocacy to bring this to legislators and to really
Yeah,
operationalize this. So yeah, I guess it's like it's evolving, but we felt like this at least needed to come out for as kind of an advocacy tool, an example of what could be, I guess.
yeah,
But the workforce is like, okay, make it happen.
right.
Like this is like
Enough
longer,
waiting.
Yeah, I think it's a question of how do we engage them, and like one of our big advocacy partners has an advocacy day in January, which is great, but who can leave their childcare for their childcare business for a day to go up to Albany for an advocacy day? These kind of things
Right.
are to engage the field and those sort of things. They're busy people, but
Donna also shared we recently made two amazing hires who came to us from public schools. They have important info about why somebody would come the other way. And so that would be interesting to check and see. And then I guess, what advice, so I think having this report, having the numbers out there, like this is going to cost us. We've talked a lot on the 9:30 call about how we have to say it. We have to say the numbers out loud. We have to move from scarcity to abundance. We can't keep qualifying or cutting ourselves down. So I guess what other advice would you have kind of in your experience as you think about the state work, the advocacy work, the policy work?
well, you know what I really like is the Center for the Study of Childcare Employment. I'm sure they have, they do this for every state. If you look at
Yeah.
Massachusetts, they include like this is the percentage of GDP that this is, and for New York,
Yeah.
it's 2.6, 2.1% GDP. It's not, these numbers are doable. So I think like to the extent we can put those numbers in context. And DC has their pay equity fund, which has been
Yeah.
running for years now. Mathematica just came out with a report and found that the ROI on that has been like 23% or something. Like this
Oh,
money
wow.
back to you in this with a stronger childcare system, with fewer people accessing public benefits. So that's something I would look at too for evidence as to, how this investment comes back to you.
Well, we are bordering states, and although we might not cheer for the same teams, we are all cheering for early educators and family childcare providers across these systems. I would love to stay in contact. I think we'd love to have you back here on the 9:30 call as you kind of see these recommendations through in your next legislative session. We're all gearing up for that, and also kind of with this overarching a new administration coming in. I think the stuff about Medicaid was really interesting because we also have heard, the last Trump administration, there were cuts to Medicaid. So what some of these federal funds fund is important to think about. We've also talked about how we want to be a place of accurate information so that if people have questions or concerns or just want to know things, that we can think about how to answering those. So thank you for putting your email in chat. And if you send me your slides, we will include that in our follow-up folder of the incredible history of the 9:30 call for 4 years. But just really want to thank you both for joining us, Rachel and Annie, the team from Denver who got up early to have breakfast together. There they are. Represent Massachusetts well. And Tom Weber sums it up. So I thank you so much for sharing New York, but go Sox. Have a great day and please stay in touch. We'd love to have you back.
Thank you so much for having us. We really appreciate it.
Okay, take care.